Welcome to our Freedom from Suffering Now blog. I'm Dr. Steve Grinstead. Today I want to talk about one important part of my working with people living with chronic pain is to be able to help them communicate with me exactly what their pain's like for them. There's a number of ways I do this. One way, though, is to teach them how to rate the intensity of their symptoms once they have identified the symptoms. Now, a lot of programs, a lot of places ask people rate your pain on a 1 to 10 scale. And I find this very problematic because my level 5 may look completely different than somebody else's level 5. So what I've done is I've developed a verbal scale to go with each of the levels. And each one's going to be different because each person's descriptions are going to be different. Now, if you're watching this video on YouTube, please go to the link below to the Freedom from Suffering Now blog, and you'll see an example of my written 10 levels of pain. So, when it's near the bottom, it's just barely noticeable. Now, I've had people who have come into my office, I've watched them. They drive up to the parking lot, they get out, they seem to be moving normally, they're smiling, they're walking calmly and easily, no pain behaviors noticed whatsoever. And as we get into the session, I ask them, by the way, what's your level of pain today? Oh, an 8 or a 9. And it's like, oh my God. There's 3 reasons why people might rate a pain level that high when it's really not. One is because no one has ever taught them how to effectively use a pain scale. Another is they have learned over time that if they don't overemphasize the severity of their pain, their healthcare providers won't take them seriously and give them help. And the third is some people, however, use it because they are wanting to manipulate and try to get the provider to give them stronger medication, for example. And sometimes it's a combination of all 3. And one of the first steps I do with people is meet them where they're at, ask them to rate the type of pain, the levels of pain and everything, and then do some really good basic education on the levels of pain, the different types of pain, how to differentiate between physical and psychological emotional symptoms. And then we have a good communication tool to where they can articulate for me exactly what their pain's like for them, so together we can build an appropriate pain management treatment plan. And again, it's really important that we have straight communications and where when they're saying 5 and then describing it, I know exactly what it's like for them. That way I can better assist them into getting the right type of pain management intervention. So thank you for your attention today, and remember, using a pain scale effectively is a big part of obtaining eventual freedom from suffering. Thank you, and please check back frequently for more updates on our Freedom from Suffering Now blog.